Quite good, quite good. I suppose the only thing that I had some concerns with is the regularity in which someone would come in to clean the room, and I think at one point I had to say to them that, you know, at some times it felt intrusive.
Overall service not very good.
Yeah, quite gorgeous. The only thing I've found really is when you're first given these prescriptions, they don't tell you about side effects. You know, what food you should not eat. I found out since going along the way there are certain things that interact with medicines. Nobody tells you those sort of things there.
It wasn't good in my opinion because they was washed off their feet. If there wasn't, then they could have been better to patients.
Overall, it's not bad.
It was good, fairly good.
I'd probably give it 55%.
Fine, that's all I can say.
You know, after you have your baby, you just say thank God, you know, everything's fine, and you thank everybody that's helped, and you feel very uncomfortable to complain what you see, you know, so you weigh out the good and you weigh out the bad.
I haven't complained. I did want to complain, but I didn't bother. I thought it was a waste of time.
I think we in Britain are so like accustomed to bad service and feel so like, you know, so like it's become unfortunately a part of nature that we're not really so like are energized to complain. But I think forums like these give individuals the opportunity to channel their positive and negative views of in this case of the NHS in Neom.
I do want to complain, but when I go to the PAL person, and the PAL person have taken down all my details and promised to, you know, return my phone call. For example, I said about the file cannot be found, and apparently I'm not the only person on that day that the file was not found. So in fact, there are quite a number of people. But I never get a return phone call from the PAL.
No, because well, I'm not one for complain. I'm grumbling now.
I would have no hesitation to go back again if I had to, or my wife had to, or I would recommend it to anyone else because it was such a positive experience.
I think it was quite positive. In that instance, it was quite positive.
Oh, beautiful, beautiful. The nurses were so good.
Yeah, I felt fairly positive.
My experience with the ambulance crew was great. That was it was nice to see that they call it the people who are at the front line of the healthcare. You know, in the face of what the general public sees was a great starting point. When I got to casualty, again, good receptionist, which again was another face-to-face experience. The doctor I dealt with was seen by was great. I just, you know, and for again, the disadvantage or the negative side is the manner of a member of staff, and also lack of information on knowing exactly how long it's going to be seen, etc.
I think overall there are a lot of room for improvement. I can only say that it's fair.
I think outpatient could do with the wait in outpatient is a bit long, and I think, you know, we could rectify that. I think a patient sitting around for an hour or so to meet a consultant, you know, we could reduce that.
In one instance, my father's file was actually lost. The records were just went missing, and when I tried to make a complaint, I did not even receive the form to make a complaint. So that's trying to keep a lid on that sort of situation. On the other hand, I think we're still waiting for the Muslim prayer rooms to be allocated in a way that the Muslims can pray better with ablution areas and things like that. And also, I specifically, I think the catering facility can be improved, where the full hot service is available to the guests, to the visitors, rather than just only for the staff. And that's something to be looked at.
It can be approved. To see the senior doctor should check
time to time, even in emergency, or they should check that the patient came over there whether he was given a right medicine or not.
I think it could be improved mainly if they was to give cleaners, people clean the toilets, the hospitals, more pay, because it's hard work, and with a decent wage things will improve.
The only way to improve it is to get more nurses, build more hospitals and have more facilities.
First of all, I think attitudes need to be changed. People have to start thinking in Neon that the staff that when they're not just seeing patients but they're seeing actual customers.
I don't think it needs to have money. I think the staff are trying their best to cope with the demand from the public. I mean, for me personally, I think it's people's attitude. I think the staff attitude need to change a little bit, because it could be because they are working so hard, they are too tired. It's not because they don't want to help. I think they want to help, but then lack of time, and also I think the manager need to be more understanding about the staff's need as well.
First of all, to tell the patient a bit more what is wrong or not wrong with them, because I think most of the people like to know. I think most of the people are capable of taking in whatever is wrong. As well, I think maybe to go a bit more in the natural, tell them what to eat a bit more healthier than what they eat now. Some people, not everybody, you know. People are not taught from kids how to look after themselves, really.
You should focus more on public health, more of preventive services, health promotion, empowering individuals to take care of themselves, supporting community health programs. Basically, I think effort should be geared towards promoting preventive services, not hospital-based preventive services, but community-based preventive services.
As many places as possible where Newman General Hospital is mentioned, I know it says underneath it something like NHS Trust. If it always, as a matter of course, also had something like including walk-in clinic, then more and more people would know that there is a walk-in clinic.